Hello, my name is Bianca Brown. Today I'm going to talk about treatment for children with mental health issues and basically determine if treatment in the home or if medication or what's actually more effective. In children and adolescents, does treatment other than inpatient facilities have a positive impact on their progress in mental health over a period of time? So children are a very special population. Any treatments that can keep them in a home environment would actually help them to continue to progress or do a little better when they're around actually people they really know. The goal is for children with mental health problems to be able to cope without being removed from their home. So, like I said again, you have different programs and different things. The research method was the main focus, obviously, of children. There were different studies examined to reach a valid conclusion. Studies that examined the effects of children's progress on the behaviors living in a facility was important because there was a need for the understanding of how these facilities affect them, whether negative or positive. Studies were also examined that involved treatment such as medication. Some studies also involved maybe aids or something coming into the home. Study 1 was the residential treatment for children and youth that was done where participants were questioned about life on a daily basis and interaction with the staff. The level of progress was addressed by determining behavior prior to entering the facility and later that month. So basically taking the children out of the home and seeing if that was effective or not. Well, the children were being mistreated and essentially exiling the children in such a manner that the family recognizes and leaves no place for the children to be able to function in family structure. So they were being kind of singled out and treated a little funny, and it wasn't a good deal. Another study I looked into was medications prescribed for children with mood disorders. So, again, research was a few controlled trials. The focus was 165 school-aged children. The children were diagnosed with mood disorders before the experiment was even started. The result was the medication stabilized the children. This helped to decrease negative behaviors which showed progress. However, when given the medicine in a facility in the first study, the children often denied to take the medicine. When the children were given the medicine by their parentals, it was a little more effective and they cooperated a little more easily. Study 3, identifying the common elements of treatment engagement in mental health services. There was a controlled study. Children between ages 6 to 15 were studied. During 90 days, small increase of negative behaviors was occurring. Children were then studied by something which you may call a therapeutic behavior aid, where they come into the home and help the parent with interventions and goals for that child's behavior. So the children were given behavior aids to implement those interventions, which would decrease the negative actions at home because the children would actually learn how to cope with and deal with the processes that needed to be developed in order for success. Children and adolescents benefit more from other alternatives such as medicine and therapeutic aids as opposed to facilities. It's actually what I came up with, and the most effective treatment was the students working with an aid. Children are very fragile when it comes to emotions. Mental health problems should be nurtured. Living in facilities are a big change, hence that had a large impact on the children, which is probably why there was a more so negative impact on the children. Children often rebel against change and allow no room for progress. When you take a child out of their original setting or their homes, they tend to feel a little like maybe cluttered or battered or, with an unfamiliar scene, and often it doesn't really work. Dealing with intervention at home will benefit children in a familiar way. In order to follow up with medication being a great alternative, the idea of side effects should be examined. So for the next study, I was thinking maybe side effects can be dealt with to determine if they're a good idea to even put the child on the medication or how long should the medication be. Clinical trials would be needed. Thank you.